Thank you for taking the time to view a demonstration of XCite Health's EMR and PM solution. Our touchscreen-enabled software provides a configurable workflow management system. Whether it's one of our customers' favorite features, the Office view, or the simplicity of the bigger icons, you will gravitate to the ease of use of our award-winning software. Let's start by scheduling a patient. After a patient is registered in the XCite PM, they can now be scheduled for an appointment. This is easily accomplished by navigating to the Scheduling drop-down menu and selecting the calendar. Here you can select the location you would like to view. This will show appointments for all providers or resources at that location. You may only view appointments for a particular provider by selecting the box to the left of their name. The appointments are color coordinated. This color represents the appointment type, and this color represents the provider the patient is scheduled with. If you hover over an appointment, you can see the details of that appointment. Now let's schedule an appointment for Dr. Smith at 10:30. This is done by simply double-clicking in the appropriate time slot. Complete the appropriate fields. These fields will be defaulted based on your selection on the left. When saved, the patient will be scheduled. To check this patient in, double-click the appointment and change the status to Patient Checked In. The patient will now be in the waiting room in the XCite EHR. As you open the XCite EHR and log on, the first screen you will see is the Office view. The Office view allows the user to see everything going on in the office in real time. Here you can see the different exam rooms. If you click in an exam room, you can see the patient, the amount of time the patient has been in the office, and any services that need to be completed along with the time that service has been waiting. The Office view is especially beneficial for practice managers. It allows them to effectively recognize and fix any bottlenecks to maintain the flow throughout the office. XCite's EHR is a workflow management system. Based on the appointment type, different work plans will fire services for users or roles at specific times. Let's log on as a nurse and take a look at the work plan associated with the sick visit we just checked in. The user assigned to bring the patient back will move the patient into the appropriate room. Once finish is clicked, the workflow is now started. The first step is ordered for the clinical staff to collect the patient's vitals and chief complaint. We can document the chief complaint by clicking in this box. This patient has a cough beginning 2 days ago. Now we can document the vitals. You can type directly into the field or click here and use these numbers, or you can pick from a list of recently entered data. After the vitals are completed, the next step is for the clinical staff to review the patient's meds. After the medications are reviewed, the clinical staff will review the patient's allergies. Next, the clinical staff can document the history of present illness with the review of systems. You can quickly set all questions to no, Then change the pertinent questions to yes and make any appropriate comments. After completion, the final step for the clinical staff is to review the patient-family social history. Once finished, the first step in the work plan for the provider is produced. We are now logged on as the provider and will take a look at the workflow associated with this role. A service bar will fire for the provider to complete the preview screen. This screen allows the provider to review what has already been completed by the clinical staff. You may document from this screen or the chart screen that we will show later. Here you can see the chief complaint, the allergies that were reviewed, the current medications that were reviewed, the vital signs during this visit, the history of present illness with review of systems, and the patient-family social history. After reviewing, navigate down to the general physical. Here I am going to select the option to use a one-touch exam. This will document the normals you have set for this exam. After the physical is completed, the system navigates back to the preview screen where the provider can now comment or close on any ongoing diagnoses, review the patient's immunization status, and review any health maintenance rules. When the provider has completed the preview screen, the system navigates to the patient's chart. The provider can now diagnose and treat the patient. This is accomplished by clicking the New Sick Diagnosis button and selecting the appropriate assessment. The system now navigates to the treatment plan for that particular assessment. Here you can order treatments that are common to that assessment. There are different lists to choose from. The common list, which every user will see, or a personal list, which only the current user may see. Depending on which treatments ordered, different service bars will populate in the office view for a role or specific user to complete. When the provider has completed the documentation, the system navigates to the billing screen where the provider can review the charges. After all service bars are completed, the patient will be moved into the billing room. When the user responsible for billing review completes this service, the patient will be moved to checkout. A green confirmation checkmark will appear, signifying the billing information has successfully gone over to the XCite PM. After you see the green checkmark in the EHR, navigate to the XCite PM to process this encounter. Hover over the Billing drop-down menu and select the Encounter Entry tab. Select the appropriate date range you would like to search for. Then select the appropriate patient. Here you can see the information that has come over from the EHR. Here is the diagnosis code, and here is the procedure code that is mapped to that diagnosis, along with the charge. After the codes are reviewed, click the Process button. This allows the system to look up the patient's insurance, the charges, and performs any frontline edits. After all encounters are processed, they can now be created into HCFA claims. To accomplish this, hover over the Billing tab. Then hover over Billing and select Run HCFA Claims. Enter the appropriate parameters and click Run HCFA Job. Once this background job has completed, the claims may now be sent electronically or dropped to paper to be printed and mailed. To send electronic claims, hover over the Billing tab and navigate down to Billing again. Now select 837 Electronic Batch. Enter in the appropriate parameters and click Run 837 Batch. This background job selects all the claims created to be sent electronically and sends them to the clearinghouse. The payer will respond on these claims, and the claims can be worked and payments may be allocated later. Thank you for taking the time to review XCite Health's workflow management system. With the ease of use and configurability, our solution is designed to allow providers and staff to quickly and efficiently navigate through daily encounters while providing the quality care for their patients. For more information about XCite Health software and services, please call 1-800-924-8344 or fill out the contact form on our website.